What is the treatment of obesity? Obesity. Obesity causes an increase in the size and number of fat cells in the body, a serious medical condition that can cause many diseases such as high blood pressure, heart disease, and diabetes. In addition to strokes and some cancers and sleep disorders, and obesity are usually assessed by calculating BMI. It is calculated by dividing the weight in kilograms by the length of meters, and the BMI index, which indicates healthy weight between the figures 18.5 to 24.9. Obesity begins when the BMI reaches 30. Some health institutions have launched a mass index of up to 40. Deadly obesity, an increase in weight more than 45 kilograms above the ideal body weight. Worth mentioning, the prevalence of obesity more than doubled during the years between 1980 to 2014. Obesity treatment. Being overweight can increase the risk of many health problems, and can be avoided and treat obesity by following the following. Diet modification, as calorie consumption is more than calorie exchange, one of the reasons that cause fat accumulation, and thus weight gain. Some foods cause weight gain more than others, such as processed foods containing additives such as corn syrup, which contains quantity. It is worth noting that eating processed, refined, and prepared foods that contain high levels of sugar and fat and increased well of whole grains and fiber-rich foods, such as fruits and vegetables, may help in weight loss, as a diet rich in fiber is able to give the body a feeling of fullness, thus reducing overeating, in addition to the fact that whole grains release energy slowly, making the person feel full for longer. Also, fiber and whole grains can reduce the risk of diseases associated with metabolic syndrome, such as type 2 diabetes, high blood pressure, and cardiovascular diseases, and it is recommended not to follow a diet that aims to lose weight quickly, due to the risk of offspring, vitamin deficiencies, difficulty achieving the goal of healthy weight loss, and the emergence of new health problems. Weight loss medications, where the doctor can prescribe some types of medications to help some people lose weight. This happens if there is no benefit from changes in diet, from exercise and weight loss, or if a person's weight greatly affects his health. The National Institute of Health notes the need for a low-calorie diet. In addition to the use of the drug, it should be noted that these drugs may cause some side effects when used, such as fatty diarrhea, effects on the respiratory tract, joints, head pain, etc. Surgery, when part of the stomach or small intestine is removed or altered, to reduce food consumption or reduce calories. This process also reduces the risk of high blood pressure, type 2 diabetes, and other diseases. Surgery reduces the size of the stomach, or alters the course of parts of the digestive tract. Physical activity. Since the body burns some calories during periods of sleep, the higher the physical activity of the rate of calories burned in the body. It should be noted that this may take a long time, because it is necessary to burn 3,500 calories to lose half a kilo of fat, and include physical activities that can increase the burning of fat: active walking, swimming, and use of stairs instead of elevator, cycling and dancing, in addition to doing housework. The CDC recommends participating in any medium-intensity activity for 60 to 90 minutes. Bone days a week. Risks of obesity. Obesity is a risk factor for many diseases, such as insulin resistance, where insulin is necessary to transfer glucose sugar through the blood to the cells of the body, including muscle cells, fat cells, thus keeps insulin normal blood sugar rates. The state of insulin resistance occurs when its effectiveness in transferring blood sugar to low cells. It is worth noting that fat cells resist more than muscle cells from insulin, and therefore insulin resistance, one of the main causes of fatty, as long as the pancreas can produce this hormone, is enough to overcome this position, keep blood sugar levels included at normal level, and this condition can last for years. Once the pancreas is unable to continue producing large amounts of blood sugar, levels to rise, causing type 2 diabetes. Hypertension. Since the disease is common among obese people, a Norwegian study has found that overweight increases blood pressure in women more than men. Diabetes. With the increased risk of developing type 2 diabetes with increased degree and duration of obesity, the disease is associated with central obesity or so-called abdominal obesity, where fat is concentrated around the waist. Gallbladder disease, which increases the risk of weight gain. On the other hand, weight loss increases rapidly and significantly the likelihood of gallstones, while in the case of losing about half a kilo per week, the risk of these stones is lower. Cancer, where obesity is one of the causative factors of colon cancer, especially postmenopausal breast cancer, where fatty tissue is important for the estrogen industry, which increases the risk of breast cancer for long exposure. In addition to obesity increases the risk of endometrial and esophageal cancer, and kidney cancer has shown some studies a link between obesity, ovarian cancer, gallbladder, and pancreatic cancer. Bone pain. Excess weight increases pressure on bones and joints, causing osteoporosis, a disease that leads to stiffness and joint pain.